The city of Berkeley is the birthplace of the organic movement. It's where Alice Waters opened Chez Panisse and had the first menu in America that was sourced locally. It's also the same hills where Michael Pollan wrote the phrase, "Eat food, not too much, mainly plants." But it's also the place where pharmaceuticals like Bayer have been manufacturing for years. It's also the place where this university has made some of the key breakthroughs on genetic modification. And it's also the place where there's a burgeoning life sciences corridor that is doing all sorts of things from genetic modification to Wi-Fi enabled pharmaceuticals. And I think that contradiction is a really good thing. I think it's fantastic that we have this healthy tension here in this city. And this event that we're putting together here is our humble attempt to celebrate that a little bit and to hope that we can start building a community of healthcare startups here in Berkeley that are doing amazing things. So with that, I'd like to welcome our two guests today. We have Daniel Kraft and Bharat Vasan.
My name is Bharat. I run product development and I'm the chief operating officer at a company called Basis. What Basis does is we're in the consumer health space. We make a device, that's this device. It collects heart rate, temperature, a whole bunch of other really cool stuff about your body. It gives you feedback every single day. It tells you when you wake up how well you slept. It tells you how much activity you're getting after you exercise. It tells you how well you exercised. So it's part of a larger movement in the space where consumers will have smaller devices like this. They connect to the cloud. You have all this data about yourself, and you get feedback, something that's actionable every single day.
Hi, I'm Daniel Kraft. I'm a physician. Currently, during the summers, I chair the medicine track at a new program called Singularity University, which is based at NASA Ames. Briefly, it's a new program that's been around about 4 years, and we bring together folks from different fields, from medicine, biotech, robotics, artificial intelligence, nanotechnology, space, energy, looking at where fast-moving trends are moving and how those might be leveraged to impact big global problems like global health and poverty and water. And I think healthcare particularly is really interesting right now because there's so many elements that are getting cheaper and faster and better and more easily available. And so there's a nice convergence period right now. So there's a lot of innovation, especially with mobile health. So a lot of folks who come to Singularity have been interested in that. So I ended up putting together a new program called Future Med, and we have a couple of alumni here from that, which is a one-week program what we've done each year to bring together physicians, IT folks, app makers, to look at where the puck is going in lots of technologies, how to reinvent healthcare. I also have a medical device background and have a new startup called Telemedicine, where in the future we want to print your own personalized pills, like 3D printing at home, so your right meds at your right spot.
The joke about America for the longest time was that we're the only country in the world where we have diseases that we get from eating too much food and not too little. But a doctor who I know, Dr. Mark Hyman, was in Haiti after the earthquake. And he was working in a hospital that was, of course, unbelievably busy with the wounded from the quake. But in a quiet moment, he asked the chief of medicine there what the major reason was for people coming to the hospital before the quake. And in Haiti, he said diabetes. And so I just am curious about your thoughts around the way global medicine is changing in light of first world problems becoming third world problems.
Well, traditionally everyone was aware of infectious disease as one of the major problems throughout the world, whether that's cholera, which has certainly been reintroduced to Haiti, to HIV and others, but actually now non-communicable diseases like cardiovascular disease and diabetes have now surpassed communicable diseases in the developing world. So, and diabetes is certainly on the forefront of that, combined with obesity and lifestyle issues. So there's a new focus from WHO and various groups recognizing that. And so there's a shift into realizing that, I think the US and elsewhere, that we need to start changing our focus from treating the 20% of patients with severe chronic disease, where we spend most of our dollar, 80% of our healthcare dollar, to shifting attention to prevention. And that can be in the US or the developing world. And new tools, mobile tools, SMS-based phones, smartphones can certainly play a huge role in that, whether that's measuring your food, glucometers attached to phones today, the ability to connect healthcare to folks who have really no access. But it's pretty clear a lot of these major problems, diabetes, cardiovascular disease, are certainly preventable by lifestyle things from eating mostly plants and not too much.
Bharat, do you want to add to that from the perspective of what people are tracking, both here in the first world and the third world?
So, we found something interesting. We have a device that nothing like this exists anywhere in the world. It collects an insane amount of data. All the stuff goes up to the cloud. And we run a whole bunch of beta tests where we show people all this data about themselves. And what we found is the way in which the data is communicated to people has as much or a bigger impact on them than the actual volume of data collected. And so there's a lot of literature coming out of Stanford around habit design. How do you create habits around products mostly? But we've been trying to figure out how do you create habits around health. How do people develop the evening walk? How do they develop eating less or eating vegetables, or switching their schedule just a little bit so they sleep better at night? And we're trying to focus on simple stuff that people could do to get those ingrained into their daily lives. And so I think there's a lot of people who collect a lot of data. I think for the mass market, it's ultimately not sustainable to digest all that information. And what they're looking for is some type of simple tool they can use every single day to try and make small improvements and have that little feedback loop of, oh, I did this, it resulted in something better. So I went to sleep early and it resulted in my sleep quality being a little bit better. I took deep breaths, it made my stress levels go down, or I worked out and I'm generally overall a little bit healthier. Same thing with diet.
And as we've had technologies like mobile technology leapfrog the US and advance more quickly in the third world, do you see any potential for that with quantified devices?
I think so. I think people have this interest in what's going on with their bodies, and they have this feedback loop with themselves where they feel like, hey, I did this and I saw the results directly. It's one of the reasons people, whether they're obsessed with weight scales or stay away from it, there's this feedback loop of, I never weighed myself for a long time, and I got a rethink scale. And every time I send that scale out, there's some level of feedback for whatever I did that day or the last couple of days that goes into that.
I'm happy you did, because you clearly need to weigh yourself.
I used to weigh 20 pounds more. It's helped a little bit. We'll let Daniel speak to that. He does a lot more of this with more medical-related stuff, but mostly the consumer wellness space.
Well, I think the whole concept of the feedback loop in healthcare is almost being reinvented. I mean, essentially today, if you go to the physician with any sort of problem, let's take high blood pressure, and 1 in 3 Americans basically has high blood pressure, and half of those don't have it controlled. And that has huge implications to heart disease, diabetes, stroke. Well, that's very expensive. The way it was traditionally treated is if you had high blood pressure and we tried exercise and diet didn't work, I'd throw some meds at you. We might bring you back in the office, or you stop by your CVS and check your blood pressure, and you scribble that number down on a piece of paper, and maybe you keep it, maybe you remember it, maybe you wouldn't, maybe you'd bring that back in or call in, but it would take months, if any, to get into proper control. Now, in the last year only, you can go to a Best Buy or an Apple store and buy a $60, $70 iPhone-enabled blood pressure cuff. I got one for my parents because my dad was running a little high, and now I get emails with his blood pressure, his heart rate, and there's beautiful charts I can log into. But that's engaging, number one. Number two, and he's pretty okay under control, but if that needed tweaking, I think that would change things. And I think in the future, if I'm doing primary care, I'm going to prescribe you not just a set of blood pressure meds, I'm going to prescribe you an app and maybe the device itself, and maybe they'll be subsidized by your payer eventually, because we'll know that you're going to get tuned into your right blood pressure med regime much, much more quickly, because you have a dashboard, that dashboard feeds back to the clinician, and because in the US at least, we don't practice really evidence-based medicine, we practice reimbursement-based medicine. It's true. If the physician is kind of bonused and rewarded for having a panel of patients who are under good blood pressure control, I'll be incentivized to kind of prescribe all that, and I'll be able to get like updates and alerts and say, oh, these 3 patients are running way high, I should check in and tweak their meds, and that'll hopefully lead to much better outcomes, because the incentives will shift to prevention as opposed to doing the dialysis, which will happen if you don't control blood pressure.
I know when it comes to chronic diseases, there's very different things that we have to measure. But what are the 5 or 6 metrics that you see these devices caring about the most, and which ones are the ones we should care about the most?
I think it's not necessarily any one metric. I like to use the example, who here has a car with like OnStar? Anyone seen the OnStar in the GM cars? And now basically your car is very smart. It gives you a check engine light when something's off. You don't know what's really the problem, but there's like maybe 200 sensors or more in the new cars. Every piston, every tire. It's lots of different feedback coming in, and boom, the check engine light goes on. You're supposed to bring it to the mechanic. Then they plug in and get high-level diagnostics. And I think, depending on who you are, different things matter more. Piston temperature, tile pressure. And I think what we'll move to is this sort of Internet of Things in this exponential age. All these sensors are getting cheaper. Well, the Basis watch, there's already the Fitbits of the world that measure your steps, your calories. But it's the integration of that in smart ways and the good user interface, the good, beautiful design of seeing that in a smart way. I mean, today the lab reports are still on white paper with a little bit of text, and folks like Thomas Getz at Wired spent like $10,000 with a design expert. They redesigned the lab report. So it's the same data, just presented more smartly. And by giving you the individual, like your own check engine light, as an example, we can hopefully catch things much earlier, before the stroke, the cancer, the diabetes kicks in. So I think it's going to be the integration of all that, and that's going to require layering in of multiple apps or artificial intelligence on top, analytics, big data analysis, and I think we're entering this era of sort of participatory medicine. So we're starting to share our data, and we'll start to learn from that and hopefully tune things much more quickly. We'll learn that the Berkeley guys who are wearing hippie sandals and are getting more sunburns and tattoos end up with some disease faster or not, and you'll get tagged to that earlier. You might get a Facebook update saying, hey, don't shake hands with Barrett today because he had the other brownies. So.
Daniel's a doctor, so he has the physician's perspective. I think about taking the data and distilling it down to stuff that people can act on day to day, because that feedback loop is easy to close. I think the hard part about prevention is kind of like smoking. It'll kill you over time. So not being active will kill you over time. Overeating will kill you over time. But it's the type of stuff that every single day doesn't feel that bad, because you're working late, you go back home, like, well, I need comfort food. It's a staple go-to, and you don't really think of the daily impact of it. So I think quickening these feedback loops around things that people can readily understand, at least in the preventive space, stuff like activity, how much you sleep, how much stress is in your life, what your diet feels like. But the types of things where if there's some level of feedback loop every single day that's quick enough, people are responsive to that. That's kind of what we found.
I know the data you're gathering from the watch is tremendous. But what are you doing on the app side to actually display and notify people about that?
Smartphones have helped a great deal. I think anytime feedback is closer to the moment where the event happened, I think that's helpful. So what smartphones do is this device, for example, connects with Bluetooth to your phone. Data goes back, we crunch it on our servers, so let's say you wake up, it can tell you exactly how well you slept. And that feedback delivered at that moment makes it a little bit more memorable, because the night before you went to bed and maybe we'd sent you 3 things you could do to improve your sleep. And you did one of them, you just had the other 2 didn't apply. If you did one of them and it didn't work a couple of days, try something else, eventually you debug yourself and figure out these are the 2 or 3 things that really work best for me. I don't need 8 hours of sleep a night, but this is what works best for me. Same thing with activity, stress, other parts of your life where you go like, hey, if I change a couple of things, it has a huge effect. So I think smartphones have helped a little bit with that, and giving people the tools to figure that out for themselves, I think, is pretty important to not do it in a more generic way.
I think people need different carrots and different sticks and different UIs, and some people like gamification with points, or the fact that they're going to lower their insurance premiums, or other hooks that'll get them into behavior change or the prevention, or staying compliant with their medical regimen. I haven't been a fighter pilot, but I've been a physician for a bunch of fighter pilots. That's a flight surgeon. And
So like a minor detail.
And the analogy I like to use there from the aviation world is the heads-up display. So if you're flying in an F-16, you don't want to be your head down in the cockpit. You want to be out looking in the world, and we have something called the heads-up display, so you can see what's happening. And you need different displays when you're in a dogfight, someone's trying to shoot you down, and when you're trying to land. And similarly, different people need different information displayed to them in different ways depending on their trying to lose weight or treat diabetes or stay on top of a diet. And I think we'll start to see new tools. You've all heard about Google Glass now. If you haven't, it's sort of basically heads-up display on a glass plate frame that Google's going to come out with probably in the next year. And that could transform health and medicine in interesting ways, because you'll be more aware of your environment. You may not eat that donut when you see how many calories it has.
So I'm curious what you guys believe is the best diet in terms of overall health.
We're entering this era of personalized medicine or individualized medicine, and I would argue, I don't have all the data, but everyone's genetics is a bit different, and the gut and our bacteria are different, our exposures are different. We're starting to be able to measure those in new ways, whether it's quantified self data or cheap genomics. I just had my exome done, which is mostly my genome sequence, for about $1,000. We don't know how to leverage all that data, but I would argue within a few years, particularly as we crowdsource information, we're going to learn that he needs a paleo diet and he needs a Pritzker diet and I need a different one based on a whole bunch of different factors. And we may be able to measure your diet, your fat intake, how you change, what your scale shows, and optimize that. So it may not be any one best diet. So there's this new field of, not so new, of pharmacogenetics. The drugs that you respond to and the dose you need are both different based on lots of factors, but particularly your genetics. And I think that's going to play over to nutrigenomics, to diet itself, to what exercise regimen might be work best for you. So that's where the power of this new age is, that we can start to not do one-size-fits-all healthcare prevention, but optimize it.
Devices like Basis are tools that provide data, in other words, and how you use it is really up to you. We measure blood flow, for example. There's an optical sensor at the bottom of this thing. It measures blood flow. So as Daniel was talking about meditation, that's something that resonates with us. We try and help people in the moment, in their real lives. So for example, if someone's stressed, their heart rate goes up. It's mostly a mental condition. There's no exertion of any kind, but you take deep breaths and you can see it go back down. It's a form of kind of a mini meditation session, if you will. It's helpful to have a tool that tells you you're that way. Because I think that when you're in a class, you're super aware of the fact that you're in a meditation class. But most people are out in their real life, there's stuff going on, and they're under pressure, under stress. 80% of the day, they probably have zero feedback about it. They're not in a place of calm or a place of exercise or a place of sleep. And that's the type of real-time feedback where technology can help you as opposed to kind of get in the way.